This presentation will walk first steps, maternity support services, MSS, and infant case management, ICM, providers on how to submit limitation extension request directly into the ProviderOne system, also known as Direct Data Entry or DDE. Why should you submit an extension request directly into the system? The requests are automatically received into ProviderOne. You can attach all backup documentation needed for processing requests, and there is less chance of the request being rejected for incorrect information. The fields you submit the information in follow the same format as the General Information for Authorization Form 13-835. Providers can continue to submit by fax if they choose not to enter and submit them directly through ProviderOne, but we strongly encourage that you enter them directly into the system. Doing so helps to ensure the information submitted is correct and there are less errors being made. It also gets the request into the system quicker. An important note is that after you have successfully submitted your extension request, the system generates a 9-digit reference number as verification that Healthcare Authority has received your request. You must not bill or perform any MSS or ICM covered services until a written approval is received. HCA's prior authorization review process has not changed, and requests will be processed in the order they are received. You will also need to ensure that all required documentation is included with your request, as well as a fax number. More information on how to submit this information will be provided in future slides. Before logging into the system, make sure that your pop-up blockers are off. After pop-up blockers have been turned off, you can log into ProviderOne using your domain number, username, and password. Next, choose the appropriate profile. The profiles needed to submit requests are EXT Provider Claims Submitter, EXT Provider Eligibility Checker, EXT Provider Eligibility Checker/Claims Submitter, or EXT Provider Super User. If you do not have one of these profiles, you will need to reach out to someone within your agency who is set up as a super user or has the access to update your profile. After you have logged in and chosen the appropriate profile, you will then click on the Online Prior Authorization Submission hyperlink. The information you will be entering on the next few slides is the information that is required on the General Information for Authorization form. You will need to click on the drop-down in the Organization field and choose 521-PA Maternity Support and Infant Case Management. After choosing the appropriate organization, click Next. Next, you will choose the service type code using the drop-down. If the request is for ICM, choose ICM-Infant Case Management. If for MSS, choose either PO-Post-Pregnancy Only or PPP-Prenatal/Post-Pregnancy. If a client has received any MSS during the pregnancy, PPP-Prenatal/Post-Pregnancy needs to be chosen, even if you are asking for additional units to be used only during the postpartum period. PO, post-pregnancy only, should only be used if the client did not receive any MSS during the pregnancy. Do not choose Other as a service type code. You will need to complete all required fields that have a red asterisk next to them. Enter the client's ProviderOne ID that ends in WA and make sure to include WA. Type in the client's first and last name. Then, in the requesting provider and billing provider NPI fields, enter the NPI, National Provider Identifier, that is used as the billing provider NPI. This is the NPI that the services will be paid to. The requesting provider and billing provider NPIs should be the same. Do not enter an individual servicing provider's NPI. Use the agency's approved MSS and ICM NPI that will be used to bill claims. In the service request line items, choose the code qualifier P. All MSS and ICM procedure codes are HCPC codes, and P is the only code qualifier used for MSS and ICM extension requests. Once the code qualifier has been selected, enter the appropriate national code. The national code is the procedure code. Choose the appropriate procedure codes for the request. The codes are listed within the MSS and ICM billing guide. If the request is for ICM, use code T1017, even if a nurse, dietitian, or behavioral health specialist will be providing the ICM services. All of the codes listed on this slide above the ICM code is for MSS only. After entering the code, enter the number of units being requested. This field does not have a red asterisk, but it is required. The from and to dates will auto-populate, so please do not change the dates. HCA staff will enter the appropriate dates when working the request. As stated in the last slide, the number of units does not have an asterisk in ProviderOne, but it is required when requesting an extension. Do not enter a dollar amount, only the number of units being requested for that procedure code listed. Once you have all of the required fields complete, click on Add Service Request Line item. The information you entered will be moved to the bottom of the screen, and it will clear the field so that you can submit another line if needed. If you need to make a correction to a line you have added, click on the blue hyperlink number in front of the line that needs correcting. Clicking the hyperlink will repopulate the information in the service request line item. After making your correction or corrections, click on the Update Service Request Line item button. If you need to delete an entire line, click on the Delete hyperlink on the line that needs to be deleted. The diagnosis and place of service codes are not required fields and need to be left blank. You must enter a fax number in comments as there is no other field for this information. If a fax number is not entered, the decision letter will not be faxed to your office and it will be mailed to the address on file. Once all information is complete, click on the Submit PA Request Info button at the top of the request screen. If you hit Submit and a red warning pops up at the top of the PA screen, there is an error that needs to be corrected before moving forward. This is why submitting a request DDE is better than submitting a request via fax. You can correct your mistake right away, and healthcare authority staff do not have to reject the request once it is finally in the system. Also, please note that clicking on Submit PA Request Info does not submit your request. You still have a few more steps to complete before submitting the final request. If no errors or the errors have been corrected, you will see this screen after clicking on the Submit PA Request Info button. This is the Submitted PA Request Details confirmation screen, and it will provide the PA request number that will need to be used on claims after the request has been approved. Note, you will notice that this says towards the bottom, No Records Found. That is because the required supporting backup documentation hasn't been attached to the request yet. If you want to print the authorization details prior to moving forward, you can click on the Print Details button. You will need to then attach all required documentation for the request. For MSS, you will need to attach MSS Limitation Extension Request Form and MSS Client-Specific Records showing progression, including the care plan and screening tools, as well as case conference notes if applicable. For ICM, you will need to submit the ICM Limitation Extension Request Form and ICM Client-Specific Records showing progression, including the care plan and screening tool. You can submit the documents as one file or multiple files. Also, you do not need to attach the general information for authorization form. You entered that information already in the system, so the form itself is not needed. After clicking the Add Attachment button, you will see this screen, the Backup Documentation screen. Click on the attachment type dropdown and choose CN-Clinical Notes. You will then choose a transmission code by using the dropdown. Select WB/web for web submission. Please note, HCA is no longer accepting documentation by mail, so you need to attach the required supporting documentation via web. As a reminder, requests cannot be completed until all required information is submitted into ProviderOne. Make sure to include all required documentation. If the MSS client is screened in at the highest risk during pregnancy, please make sure to also include the case conference notes. After you have chosen Clinical Notes in Web, click on the Browse button to upload the supporting documents. After you have chosen the correct file, click OK. The supporting information will show in the Attachment List section. Documents cannot be bigger than 10 megabytes, and the file formats allowed are PDF, GIF, JPEG, DOC, DOCX, and XLSX. Also, make sure that the client's name is included on the client's chart notes so that we know the records received are for the correct client. After adding all supporting documentation, you can then submit the request. You can click on the Print Details button for a copy of the authorization information, including the supporting documentation. Again, supporting documentation is required, and the required information is outlined in the MSS and ICM billing guide. Make sure that all required documentation is attached prior to submitting your request so that there is no delay in making a decision. Once you have all of the information and backup documentation entered into the request, click Submit. If you do not click on this final Submit button, the request will not be uploaded into ProviderOne. Now that you have submitted your request, you can check the status of your request by clicking on the Prior Authorization Inquiry hyperlink on the provider portal. You can check by entering the authorization number in the prior authorization number field, or enter the NPI, the billing NPI used on the request, and the client ID ending in WA, or the provider NPI, client last name, client first name, and client date of birth. It is much easier to search using the authorization number, the 9-digit number, especially if more than one request has been submitted for the client. If your search is successful, you will see this screen. Please note you will always see the status of error right after you have submitted your request. Error on this page does not mean that you have made a mistake. The error status will remain until Healthcare Authority staff have forced the errors. This is a list of the different statuses you may see on the request. Generally for MSS and ICM requests, you will see error, rejected, approved, or denied. If you become stuck or have questions, first check out HCA's prior authorization webpage. If you need to include additional documentation to an already submitted request, email the First Steps program managers at hcaFirstSteps@hca.wa.gov. You can also contact the Prior Authorization Office for assistance in submitting a request. If your question is related to MSS or ICM specifically, please reach out to the First Steps program managers, as the authorization staff cannot answer program questions.